Garcia, and I practiced oncology in St. Louis, Missouri for 27 years. I specialized in breast cancer for all of that time. And when I first began practicing, the women that I saw in my office every day were in their 50s and older. But as time went on, younger and younger women appeared on my schedule. Women who were in their 40s, 30s, and 20s. And then one day, I had a 17-year-old who came into my office with her parents to discuss her breast cancer treatment options. I felt so devastated that day as I was meeting with that young teenager. But when I think about it today, it's not much different than what we're seeing right now. 5- and 8-year-old children being diagnosed with type 2 diabetes, or young people who are being seen in physician offices each and every day, diagnosed with chronic diseases that used to once affect only grandparents. So I became a holistic physician. I had had enough of seeing these young women come in day after day, and I began to counsel my patients about diet and lifestyle. And I pointed out that their excess weight was causing estrogen dominance, and that was increasing their risk of breast cancer by more than 50%. But my advice about getting to a healthy weight wasn't working. And each year when my patients would come in for their annual checkups, they were heavier and heavier. So one day I was introduced to our wonderful program by a friend of mine, and I felt like I finally had the tool to help my patients get their weight off fast and safely, and therefore not only reduce their risk of breast cancer, but also reduce their risk of the major killers: heart disease, stroke, diabetes, and Alzheimer's. They could reduce their risk of all of those things. Now, as for myself, I have never had a weight problem, but my life was completely out of balance. I loved my career in medicine. I went to work every day. When I walked in the door, I gave it my all. I gave it my heart, and I loved it. But after I had children, I would have loved to have worked fewer hours, to have more time to spend with my children. But instead, as a single mom, I rushed off to work every day, and I always got home later than I wanted.